Well, for more on this, we can speak now to Jessica Firger, who's senior health writer at Newsweek, and she's there for us in New York. Good afternoon to you, Jessica. I wonder what your principal health concerns are in this situation at the moment.
There's a lot of different health concerns. We can start with the flood water that's currently all over the city. Typically in situations like this where there's hurricanes and lots of water, the water is never clean. It can carry all kinds of pathogenic bacteria. Some of them include E. coli and Vibrio and a bunch of other ones that can cause serious gastrointestinal illness. This morning, the explosion at the plant released organic peroxide, and there's not a whole lot of research on the long-term effects of that. The short-term effects include eye irritation and just general respiratory problems. There are some studies that show that the long-term effects, it can cause tissue change and some erosion to mucous membranes. And then, of course, there's all kinds of issues with limited access to medical care and food.
So
Those are some of them.
Indeed. So going back to the chemical plant, and we're showing pictures of it as we speak, even contact with the water there is potentially worrying. It's not as if people have to swallow it to be in danger. It's simply contact with the skin, and there are potential problems there.
I think that we don't really quite have confirmation on that right now. The reports are saying that the area has been fully evacuated, and it was evacuated several days ago because officials were unfortunately anticipating that something like this might happen. But we do know that the water, if it is consumed, is carrying most likely bacteria. After Katrina, there was a study that looked at the health effects of these types of bacteria, and there were a couple of deaths that resulted from the Vibrio illness.
What then of the scale of help required? You touched on this a moment ago, but given the numbers involved here, how is it realistically possible to get as much help to that region as it needs just now?
I mean, it's really complicated because you have people overcrowding shelters, and the city has set up a number of mobile clinics to address a lot of the health concerns. But in cases like, for example, GI illness, some of these illnesses do require antibiotics. And so I think that, I can't say how many deaths there are going to be, and I don't want to necessarily blow it out of proportion. But I think the thing to note is that this is going to be a long-term situation where people are suffering health-wise, first of all, because they have a limited access to resources. And then down the line, I think we will most likely see longer-term health impacts of things like this chemical spill.
And also psychological help for people who've just witnessed things that are quite horrific.
Right, that's true. And I know that most shelters have psychologists that are coming to the shelters to address those issues, in particular with children, of course.
Sure. Okay. Jessica, thank you so much for that. Jessica Firger there of Newsweek magazine in New York.